Welcome to educational video on endodontics. This video is about emergency treatment. On this video, I will cover the objectives for emergency treatment, a simple questionnaire that can aid diagnosis, common emergency treatment modalities, and finally, when to expect the unexpected. So, let's get started. An emergency appointment is one where a patient cannot wait until a scheduled appointment. The most common reason for patients seeking an emergency appointment is pain. The dental pulp is a densely innervated organ encased by hard tissue. Therefore, inflammation of the dental pulp can be a very painful experience for patients. Here is an illustration of untreated caries and the effects on the dental pulp. Pulpal inflammation is a progressive disease. Evidence of pulpal inflammation occurs even before caries reaches the dental pulp. This is often known as reversible pulpitis. If left untreated, this inflammation progresses and can lead to symptomatic irreversible pulpitis. Symptomatic irreversible pulpitis can present with acute, sharp, shooting, throbbing, radiating pain. The origin of this pain can be difficult to localize in an acute situation. Interestingly, pulpitis can be symptom-free for the patient. In this case, the disease can progress to pulpal necrosis unnoticed. A necrotic pulp can cause acute apical periodontitis with symptoms such as pain on chewing or biting. The disease can further progress to an acute apical abscess or swelling. When this occurs, it is important that the practitioner has a good knowledge of pathways of spread of infection in the orofacial region in order to manage the patient. The objectives for emergency treatment are to alleviate pain, control infection, and prevent systemic complications. Here is a simple questionnaire that can aid your diagnostic process. The first question is, how long have you had pain? The most frequent day endodontic emergency patients seek treatment is on day 3. Remember that the longer the patient waits, the further the disease progresses. Pain lasting for more than 3 months is considered chronic pain. This may or may not be related to endodontic problems, so be aware of differential diagnosis. Tooth with infections or cracked tooth syndrome can give rise to chronic pain. The next question is to rate how much pain you are experiencing between 0 to 10, where 10 is the worst pain ever and 0 is no pain at all. This is also known as the visual analog scale or the numeric rating scale. Patients with symptomatic irreversible pulpitis report a mean pain score of 7. Patients with acute apical periodontitis with partial or complete necrosis report having a pain score between 7 and 8. Patients with swelling have more varied pain experience ranging from 2 to 7. These patients often report less pain when the swelling appears. Long periods of pain with low pain score can present as a diagnostic dilemma. The next question is to ask the patient which tooth the pain is coming from. If the patient is unable to localize the pain, it can give you a clue that this may be symptomatic irreversible pulpitis. Asking the patient if they are taking medications and if they can sleep at night indicates the effect of pain on the quality of life. This information helps you in your decision to prescribe drugs for the patient. It also gives you information on the urgency of treatment. If the pain gets worse after consuming hot or cold food or beverages, you can suspect pulpitis. This is because the nerve fibers need to be intact, such as in the vital pulp, in order for the brain to register pain sensation upon stimuli. Pain on biting or chewing indicates apical periodontitis. In these cases, the pulp can be either necrotic or partially necrotic, or the patient may present with secondary endodontic infection under a previously root-filled tooth. Next questions are to ask the patient if they are noticing any signs of fever or swelling. A yes to this question means that there is already systemic spread of this infection. It also indicates that you may have to consider antibiotics if you do not manage to treat the patient. Now proceed to clinical examination and radiographic assessment. Once you have established the diagnosis, make an emergency treatment plan and a permanent treatment plan. Often, the permanent treatment plan is root canal treatment or surgical or non-surgical retreatment. When there is limited time to perform treatment, you make an emergency treatment plan. Of course, extraction is one of the options. However, unless your diagnosis indicates that a tooth cannot be saved, for example due to vertical root fracture, aim to get the patient symptom-free before you discuss a permanent treatment plan with the patient. Good communication is important. Therefore, communicate with the patient. Discuss the condition with the patient, explaining the emergency treatment plan and the proposed permanent treatment, the expected duration of the treatment, associated costs, and finally the prognosis. If you do not have a diagnosis, do not treat the patient. Otherwise, you might end up in a situation where your treatment has provided little benefit for the patient. The most frequent diagnosis for patients who attend an emergency endodontic appointment is symptomatic irreversible pulpitis. This is followed by symptomatic apical periodontitis and finally acute apical abscess. Now, let's look at emergency treatment modalities. If you diagnose the patient to have symptomatic irreversible pulpitis, then you need to perform pulpotomy as an emergency treatment. If the patient has pulpal necrosis as a diagnosis, you perform a root canal debridement. If the patient has an abscess, first you try to achieve drainage through the root canal or canals. If that is not possible, you may need to perform an incision and drainage. You may also consider using medications as a supplement to your treatment plan. Before you start your treatment procedure, give the patient very good anesthesia. Test that your anesthesia is working. Pulpotomy is to remove all the pulp tissue from the pulp chamber. Make sure you use the rubber dam. Irrigate. Once you've removed all the pulp tissue from the pulp chamber, place a sterile cotton pallet and seal the cavity. Emergency treatment for a tooth with pulp necrosis. Start with anesthesia. Remove all the caries. Prepare a cavity preparation. Make sure you work under the rubber dam. Remove all the necrotic tissue from the pulp chamber and as much as possible from the root canals. You may use thin files to remove necrotic pulp tissue from the root canals. Use copious irrigation. Fill the root canals with calcium hydroxide. You may seal the root canal with sterile pallet and a temporary filling material. A patient with acute apical abscess, you perform the same treatment as you would for a necrotic pulp to establish drainage through the root canal. Pus and blood can drain from the apical abscess via the root canal. You have to wait until the drainage stops. Irrigate copiously. Place calcium hydroxide and seal the root canal. If the patient has a soft and fluctuant swelling, you can perform incision and drainage. The commonly used medications for endodontic emergency treatment are painkillers, anti-inflammatory drugs, and antibiotics. What you prescribe is dependent on the drugs the patient is already taking and the diagnosis. For example, a tooth with pulpitis needs painkillers and not antibiotics. The patient's anamnesis should give you an idea of whether you need to prescribe antibiotics. For example, immunocompromised patients may need antibiotics even when you manage to drain the purulent exudate. When to expect the unexpected during treatment procedure. During pulpotomy, even though the patient has profound anesthesia, the tooth can still hurt when you reach the pulp horn. This is often referred to as a hot tooth. When this happens, you need to give the patient an intrapulpal anesthesia. The intrapulpal anesthesia is very painful, so inform the patient that this is going to be painful. Teeth with necrotic pulp may have vital pulp tissue. This happens in multi-rooted teeth and in the apical part of the root canal. When you drain pus through the root canal system, sometimes it takes a very long time to stop draining. In these cases, you have to wait. If you cannot wait, you can place a cotton pallet and see the patient the next day. The next day, place the rubber dam, irrigate the canal, make sure there's no more pus draining. Then place calcium hydroxide and seal the canal with pallet and temporary filling material. With that, I will say good luck with your next emergency patient and thank you for watching this video.